Joining us now, Dr. Scott Gottlieb, former FDA commissioner and a CNBC contributor and a board member of Pfizer and Illumina. Doctor, do you get newspapers out there? Are you able to see? Did you see the Wall Street Journal this morning? I'm referencing an op-ed piece that I think a couple of researchers out in Stanford put it together about the mortality rate. I don't know what you think of this, but anything that I see that could be positive, I at least try to give it a fair shake. And they're arguing the mortality rate we could be overestimating it by a factor of 2, 3, or 4, or 5, even I think it's based on the denominator once again. But they say it could be more akin to 0.3% than to even a 1 to 3% mortality rate. Did you read that article, or do you think that's possible?
Yeah, I saw it, and we've talked many times on this show about the mortality rate. I've said to you, and we've spoken about this, might be anywhere between 0.5 to 1%. And so it's possible that when this is all over and we figure out what the background rate of infection is, we'll see that the mortality rate was a little bit below 1%. I don't think it's going to be as low as 0.3, but it might fall somewhere between 0.5 to 1% in a well-functioning healthcare system that doesn't become overwhelmed. But we need to remember this is making a lot of people critically ill, so we shouldn't just look at the case fatality rate, but also look at all the people who are having prolonged ICU admissions from this infection. And we also need to look at the fact that the hospitals really are on the point of getting extremely pressed and perhaps being overwhelmed in cities like New York right now, because once that happens, then the mortality rate is going to start to increase. It's going to start to accelerate.
Hey, doctor. Two questions. One is the president putting out this deadline or at least goal of April 12th to get much of the country back to work. Does that make sense to you?
Look, I think if you look at New York City, so let's just take New York City, for example. The governor has said they're 2 to 3 weeks away from peak infections. That's probably true. And it might even be on the lower end of that. You'll continue to have hospitalizations increase for another maybe 2 to 3 weeks after that peak. So we're looking at a 5 to 6 week period between now and when hospitalizations are going to peak in New York City, and maybe 2 to 3 weeks until you have cases peak and then they start to decline in New York City. We need to be pouring all the resources we can into New York City right now to deal with this. This could become, a major tipping point in New York. Now, the question then becomes, what cities are next? Are there other cities seeded as much as New York that are going to have similarly sized outbreaks on a per capita basis? You have to worry about Miami right now, Atlanta. I'm worried about New Orleans. You look at cities like Chicago with mass transit systems. So if we can keep another city from having an epidemic on the scale of New York, we can get through this more quickly. If other cities start to have epidemics at a staggered period and on the scale of New York, where we have to now marshal resources and move them into those cities, this is going to be a longer epidemic for the entire country.
So what is
Scott,
the earliest?
I know you spoke to doctors in New York. Scott, I know you spoke to doctors last night in New York City. Can you tell us? Can you tell us what you heard?
It's a difficult situation. So the hospitals are full. They've increased their bed capacity. They've all implemented their emergency procedures to increase their bed capacity already. The hospitals are near census. I looked at the census data on a number of New York City hospitals. They're near census. Largely all the vents are being used. They're managing unstable patients now in what we call step-down units, not in the medical intensive care units. There's only vented patients by and large in the medical intensive care units. And the doctors are working long shifts. They're just about at maximal capacity. NYU announced that they're going to graduate their medical students early to transition them into being interns right now. That's how short they are in staff. So the New York City hospitals right now are on the brink of being what I would call maxed out in terms of their available capacity. And once they reach that point, we're going to start to see people go into other settings of care like the Javits Convention Center, some of these hotels that are being set up, and some of the steps that they're taking to create increased bed capacity outside of the hospitals. But New York has another about 5 weeks to go for this between now and when they're going to hit peak hospitalizations. And so the fact that they're stretched right now is worrisome. I think what we need to be doing is developing mobile, basically the equivalent of MASH units and moving them around the country, having them available, moving all the resources we can into New York City right now with the expectation that once New York City gets over this hump, we might need to move it into another city. What China did very successfully was bring in massive resources into Wuhan and into the Hubei province, thousands of doctors. We probably don't have that luxury. We don't have the level of control that they had, but we need to do something sort of equivalent if we can.
All right, Dr. Gottlieb, thank you.